everyone, and welcome to the Fat Doctor podcast. I'm your host, Dr. Ashalami. If you're watching me on YouTube, you may notice a different background. It's because I'm recording in a different place today. I'm going to see if this works. It would be a lot more useful for me if it did work. I'm going to check out the sound quality after I've recorded. So if the sound quality is crap today, I did a thing. It didn't work out. Sorry about that. That's how professional we are here at the Fat Doctor podcast, if those of you who are new. So today I am really excited to do a podcast episode all about the lies that surgeons tell their patients. The lies. These are real life lies. These are lies that have been told to real life people with real lived experience of lying liars who lie about surgery. In particular, in this case, it's knee and hip replacements. And I know all about these lies because I've recently done a masterclass. That's the word. Oh God, my brain. It's getting worse and worse. If you've been listening since season 1, can you let me know, email me or something to let me know whether or not you've noticed a shift over time, like a natural decline in my ability to just talk. To find words, because I think that it's getting worse, but I can't tell. And I've been recording podcasts now for a few years. So if you've been listening in and you're just like, bloody hell, Ashley, you're getting old. Bit of brain fog there, maybe. If that's something that you've noticed, please let me know. Because I'm kind of convincing myself that it's all in my head, but maybe it's not. Maybe you've all noticed it as well. Anyway, this isn't about me. This is about you and your real life lived experience of lies, of lying doctors who lie, lying surgeons who lie. Is that the title of the podcast episode? Probably now. Lying surgeons who lie, lying liars who lie about surgery. And so I did this masterclass and it was really good and I really enjoyed doing it. And it was on the day of the US election. And of course, I'm recording this prior to knowing the results of the election. So if you're listening post-election, I don't know, the world could have ended. Who knows? If the Cheeto has his hand on the, nuclear codes, I can't make any guarantees. I can't even have faith that things haven't gone awry. So let's just hope that didn't happen. But right now, I'm feeling positive and chipper because we don't know what's going on. Either way, you know what? No matter who wins the American election, no one actually gives a fuck about you or me. I don't know if you know this, but they don't. Don't care who the politician is. I appreciate that there's levels of bad and that some are worse than others, but they're all bad. All bad. And nobody cares about fat people. Nobody cares about black people. Nobody cares about Palestinian people. Nobody cares about... Well, that's not true. Not nobody. But nobody in power cares about these people. So... Irrespective of the results of the election, I did a masterclass and people were like, my surgeons told me this. Is this true? I'm like, no, the fucking audacity of it all. Outrageous. So if you're interested to hear more or want to know more about arthritis, then you can always check out, just because the masterclass is finished doesn't mean you can't check it out. It's still available. But here are some of the things that doctors have said to their patients. Okay, here's one. Weight doesn't necessarily cause arthritis. Oh, that's nice. That's good. But it's pure physics. Physics, always very important physics, that theoretical science that somehow is supposed to trump all other sciences. But I've got a son who really loves physics. I'm probably going to study physics or engineering, and we'll often talk about the lesser sciences. Biology, physiology, a lesser science. What a dick. Anyway, physics, that there is less weight on a joint, it might not cure but will certainly help ease arthritis pain. Maybe this lying liar who lies probably makes the best point of the bunch. I don't agree with them, but at least we can all agree that being fat does not cause arthritis. It doesn't. And we've got so much evidence to support this now. And like I said, we talked about this a lot in the masterclass. I did an entire explainer video, 15 minutes, where I explained all the reasons why people get osteoarthritis of the joints. And guess what? Weight wasn't part of it. And even if being fat, being high weight is linked to arthritis, that doesn't mean it causes it. There are many, many factors at play that could potentially cause both weight gain and osteoarthritis. And I'll give you some examples. Weight cycling, weight stigma, stress, insulin resistance. All of these can cause weight gain and osteoarthritis. So, let's not assume that one causes the other. But we agreed. This surgeon has agreed with me, so we don't even have to argue this point. But then there's physics. Less weight on the joint might not cure it, but might help ease it. And it's a fair point. I talk a lot about this joint nonsense. Physics taught me that when you've got force on a joint, the force can be acting in two separate directions, right? The force on the joint coming from above, coming from the body, and the force on the joint coming from below, coming from the floor, basically. And so when you take a stride, there's force going upwards towards the knee joint from the ground. When you run, that force increases. When you jump, that force increases even more. I believe, don't quote me on this, I believe that when you jump, it's 8 times the amount of force on the joint than if you just take a stride. I believe that's the case. So therefore, you would have to be, so if you've got a thin person who's jumping, that's the equivalent of someone who is 8 times as heavy taking a stride. I just want to put that out there. Physics. However, fair point. If you've got damage to the joint, the more pressure you're putting, the more load you're putting on the joint, the more it's going to hurt, right? That's reasonable. So the argument is, physics tells us that if you're smaller, it'll hurt less. And that we can agree on. However, there's no way to miraculously become smaller, right? You can't suddenly just become small. There's no magic wand. We were talking in the masterclass about liposuction, which I said might actually be a solution. Because if you had a liposuction, you go in surgery and they just suck all the fat out of you. They're sucking the fat, by the way. They're not interfering with the muscles. Just sucking the fat out of you. And then the load on the joint decreases. And theoretically speaking, wouldn't that mean that your arthritis got better? Or the pain from the arthritis got better? There's something in there. Don't quote me on that. I mean, you could probably, I think that there is a risk of dying in liposuction. So there's that. But is that true? Does liposuction help with load on the joints? Physics would argue that yes. The physicist, the engineer, my son would be like, well, absolutely. It's just plain physics, isn't it? But let's just say liposuction's off the table for a moment. Off the table, get it? Because surgery. Anyway, if we take liposuction away, then the options we're left with to become smaller, to reduce this theoretical load of the joint, is to go on a diet, pursue weight loss, through diet and exercise, or weight loss injections, or weight loss surgery. Those are your 3 options, right? Now, all of those things can increase your pain levels in many different ways. Energy restriction decreases dopamine, decreases serotonin, decreases oxytocin levels. Oxytocin, nature's pain reliever. Literally, nature's pain reliever. Reduce dopamine, increase perception of pain. Reduce serotonin, lower mood, increase anxiety, increase perception of pain. So energy restriction is already going to mess with our pain thresholds, which is why a lot of people say, I've gone on a diet. It's made things worse. Then you've got cortisol, stress, inflammation, inflammation, that thing that causes osteoarthritis, inflammation. And that's no good. Also, inflammation is bad for you in general, in case you didn't notice. So going on a diet increases your cortisol levels, and that increases inflammation. Going on a diet causes a reduction in lean mass before a reduction in fat mass. So you're going to lose mass. And there are all these people that are like, no. If you just exercise, then it won't happen. That's not true. We've got studies that have demonstrated over and over again that's not true. You cannot mitigate the amount of muscle loss just by exercising. And anyone who says you can is lying, because the evidence is very clear here, especially if you're older. And people who have osteoarthritis tend to be older. So no. Also, going on a diet can reduce your bone, often reduces bone density, right? It reduces fat. People have higher bone density, thin people have lower bone density. Lower bone density, bad for osteoarthritis. By the way, what's a good way of managing osteoarthritis? Muscle strengthening, of course. So muscle wasting, bad. What else? I'm trying to think what else. Oh, insulin resistance. Yes. Weight cycling linked to insulin resistance linked to osteoarthritis. I mean, you see, the problem is that once you start trying to lose weight, any of the supposed benefits that you'll get from reducing the load on the joints, will be countered by all of the other issues that you get, the risks, the harm that come from losing weight. So theoretically, I agree with your surgeon. It's just that realistically and logically that doesn't work. Another one is that people who have lost weight report just how much their pain has eased. So of course, weight loss is good for you. Listen, there are people out there that will report all sorts of things, like I voted for Trump and my life got better. Okay, cool. Because I can find just as many people that say the opposite, and I can find you plenty of people that say I lost weight and my joint pain's never been worse. So I'm not going to listen to people's experiences. I'm going to look at the evidence, and the evidence shows a minimal, at best, improvement in pain scores post weight loss. Minimal at best. Even the authors of one of the studies, the biggest study I could find, found a study, it was a really good study, found the results, and I was like, well, there's a little bit of a difference. I think it was like a reduction in the pain score by like 2.5% or something like that. It's better than nothing. Even the authors admitted that it wasn't really of clinical significance, was it really? 2.5%. I wouldn't argue that was a big breakthrough, but there you go. So the evidence says otherwise. Okay, there is no evidence that you know what does work: joint replacement. And then so knees bear the additional weight of fat thighs, and that's why you need to lose weight for arthritis of the knee more than you need to lose weight for arthritis of the hips. And I thought this one was really funny because I was like, well, that's interesting because hip arthritis has a much worse prognosis than knee arthritis. So how does that work? Like, surely it would be the other way around, wouldn't it? By that theory. So that's one doctor. God, doctors, dickheads. Here's one. Do you know what? I also like this one because this doctor was at least honest. I'm in the US. Biggest question: how to overcome the surgeon's resistance? Because basically the surgeon said that it's more difficult for him, so he doesn't want to do it. And I was like, well, he admitted it out loud. Most don't have the audacity. This one clearly was loving himself and just could say it out loud, because this is the issue, folks. You want to know why they're denying you surgery? It's not because of infection rates and this, that, and the other. It's not because of that. They say that's the reason. That's what they'll tell you. The reason is simple, and every so often a surgeon will admit it. And this surgeon admitted it. But it's much harder. It's hard. It's more work. And I get paid the same amount of money. It's going to take longer. I'm going to have to work harder. It might be more difficult, more challenging for me. It might hurt my back when I do it. And so I don't want it. And, there was a very interesting, very, 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 very problematic podcast that I got involved with a little while ago between Jessica Wilson, someone who I do not recommend to anybody. She is a thin dietitian thin cisgender dietitian who spends a lot of time talking about fat trans rights, which I find to be a bit problematic. But in this particular episode, she was talking to a thin cisgender gender affirming surgeon. I believe he's cisgender, although possibly they I don't know if they use they pronouns now. They didn't used to, but maybe they do now. So I'm let's put their gender identity to one side. But Jessica Wilson definitely is a cisgender woman, and they're both thin, and they were having this extremely problematic conversation about BMI limits in gender affirming surgery. But what was really interesting was this surgeon admitted it out loud on the podcast. But it's harder for me, and I get paid the same amount of money, so why would I do something that's harder for me? And I was like, that's, at least you're admitting it, at least you're saying it out loud. Good for you. However, if you think it's okay to deny people surgery because it's harder for you and you would have to put in more work and you don't want to do that, then you're in the wrong profession, sir. Get the fuck out. Let someone else do your job. You don't get to go, I don't want to, because that's not how it works. And if there was an argument to be made that, look, the benefits of this surgery do not outweigh the risks. I still do not believe you have the right to deny somebody that surgery, because at the end of the day, autonomy is this big thing that we as doctors are taught about. You get to choose, the patient gets to choose what happens to their body. Even if the risks we believe outweigh the benefits, we're still supposed to observe their wishes. However, even if you could deny them, when it comes to joint replacement surgery, the evidence is extremely clear. It doesn't matter what weight you are. The benefits will always outweigh the risks. The evidence is clear here. There's plenty of evidence to support that. So you can't even make that argument, right? The argument is simply, I don't want to do it. And if you don't want to do it, then somebody else should. You shouldn't have a job. You shouldn't get paid to do anything. If you don't want to do it for some people, then you shouldn't be allowed to do it at all, is my opinion. Some of the other things this surgeon who didn't want to do it said. So, infection rates in the new hip post-surgery for people with higher BMIs are much higher. Much higher feels like a little bit of an exaggeration. Much higher implies significantly higher. My question would be, okay, well, how much higher? Give me a number. Statistic, please. What's really interesting is that the evidence shows that weight loss prior to surgery does not reduce infection rates. And I repeat that. Weight loss prior to hip or knee replacement surgery does not reduce infection rates. That's what the evidence says. So I'm not sure what I'm supposed to make of that one. So maybe it's true. Maybe there is a higher infection rate. And what? It's my risk, my life, my surgery, my infection. Also, can you treat infection? Well, yes we can. How? With antibiotics. Well, can't you just do the hip replacement and give me the antibiotics then? I like this one. The pain is off the chart. Stage 4 cancer level. Do you know what? That's real fear mongering there, isn't it? Stage 4 cancer. What a threat. First of all, sorry to anyone who has cancer and is listening to this, because it's always awful when people threaten others with some condition that you have. I find that with diabetes, like, not that I'm comparing cancer to diabetes, but like if you're unlucky, you'll get diabetes. Oh, cool. I have diabetes. What does that mean about me? Oh, your pain's going to be as bad as a cancer patient. Like, we know that cancer is painful. There's no need to use that. You could just say off the charts. You don't have to say stage 4 cancer, because there's literally no evidence to suggest that the pain levels are the same. Pain is a subjective thing. Like, come on, man. There are plenty of people with terminal cancer who are not in any pain, and there are also people who do not have cancer that are in a lot of pain. So can we just not use that straw man analogy? There's just no point in comparing the two. However, what I will argue is that I've treated people with cancer for a very long time. And you know what we do when people have cancer and have pain? We give them painkillers. You get that, right? We prescribe pain relief. If your doctor's not prescribing you pain relief and you have pain and cancer, then your doctor is shit. You need a new one. And so if it is that bad, why not just prescribe me painkillers? Have you noticed that one drug company, everybody was fine, and then along came fucking Purdue with their fucking Oxycontin. I'm swearing a lot today, and I really apologise if that offends you. Probably might want to turn off for the rest of this. Purdue and Oxycontin ruined it for everybody. Now you can't get painkillers ever. Why? Now you have to suffer in pain because some greedy family, the Sackler family, and their malevolent greed has ruined it for everyone. We're going to be saying that about Novo Nordisk one day soon. Just FYI. It'll be too late by then, but we'll be saying the same things. Mark my words. I said it on the 5th of November 2024. We'll be saying the same thing about Novo Nordisk that we did about Purdue, that we have been saying about Purdue. But anyway, we don't give people painkillers anymore. Have you noticed that? Also, if your pain post-operatively is going to be off the charts, compared to what? How's it going at the moment? And some might argue, 2 weeks, 2 months even of post-operative pain compared to a lifetime of chronic pain. Like, who are you to tell me which is better? You're not living with my pain, are you? Fucking doctors. Here are some great ones. Oh. So, You might get COVID and you'll die because you're fat. To be fair, this was at the beginning of the COVID pandemic. So, we were lying to all patients. And also, we weren't really doing hip replacements or knee replacements during COVID. So maybe in the first couple of years. After that, shut up. Oh my God. I think surgeons say, I won't be able to bend your leg into the correct position because your tummy would be in the way. I'm trying to keep a straight face here. It's a really shitty thing to say. And I thankfully have never had to work in orthopedic surgery. I've not done a single orthopedic surgical procedure ever. I managed to get out of it. There's a lot of general surgery, no orthopedic surgery, because orthopedic surgeons are the worst kind of surgeons, in my opinion. Really horrendous human beings. And then the surgery is pretty gross as well. Pretty grim. Like, there are hammers and saws, and it's not for me. I get quite queasy around bones. So I swapped it. Like, hearts, lungs, intestines, not a problem. Rectal surgery doesn't bother me. Body fluids, I'm fine. Broken bones. Ooh. It was the road traffic accidents and the fractures that I used to really freak out over. It was not for me. That's when I realised that I had no career in emergency medicine because I couldn't handle those. So anyway, I avoided orthopaedic surgery. So I'm not an orthopaedic surgery expert by any stretch of the imagination. But however, I have performed or assisted, not performed personally, but assisted in a number of surgeries where tummies got in the way. Abdominal surgeries where tummies got in the way. Obstetric surgeries where tummies got in the way. And you know what? There's always a workaround. Like, it's just fat. You can move it. You can shift it. That's what junior doctors are for. Junior doctors are there to scrub up, stand in surgery and for 2.5 hours, pull the fat back. That's their job. So that's what being a junior doctor is all about. It's tiring work, I would argue. But come on, man. This is just another way of a surgeon saying, I just can't be bothered to do the surgery. I can't be asked. I just don't want to do it. So I'm just going to tell you that it's not physically possible. Of course it's possible. There's more. My weight might bend the new hip joint out of shape, and then it would be a waste of time. Now, I wonder what I should have Googled. Maybe I'll Google it right now in live. What are hip joint replacements made of? Oh, look, Google told me straight away. Cobalt chrome, titanium. Is that not the strongest metal? Or maybe there's another one that's stronger than titanium. Cobalt chrome is this is what Google told me. Socket is usually made of titanium. The ball is either metal, ceramic, or cobalt chromium. The stem is usually metal. So I'm guessing, I don't know, but I'm guessing that these metals and whatever that they use are as strong as human bone. I'm guessing, because I assume that they're not going to put anything that's softer than human bone in there. That wouldn't make sense. So if your weight's not magically bending your hip joint out of place, which it is not, that is not what happened in arthritis. It's about cartilage loss, right? We know it's not about being bent out of shape. Hopefully we all know this. So if it's not happening to your bones, why is it going to happen to the replacement? What kind of shitty products are you using? My argument there would be get me a better hip joint. Why are you getting for the basic hip joint? Get me the premium hip joint. What would my kids say? Lidl, that's a Lidl hip joint. Get me the creme de la creme, Harrods hip joint. I can't believe people say these things. Lying liars who lie. The risk of infection after the operation would be higher. Again, we've talked about this before. We get a lot of this. The risk of infection. Also, the risk of anaesthetic. There's complications from anaesthesia. The surgeons love to do this one because then they can shift the blame on to the anaesthetist. Now, I don't know where you live in the world, but in the UK, we use the advice from the Royal College of Anaesthetic. The Royal College of anaesthetists, anesthesiologists, and we call them anaesthetists in the UK, and I think that's what the Royal College is. But anyway, the Anaesthetic Royal College, that one. So I looked it up, and there is nowhere nowhere in their guidance that says we should not be performing anaesthetics on fat people. Also, there was a very big audit that was done back in 2011. The largest audit of post-surgical complications, of anaesthetic complications in the world ever done to date. 2011, done in the UK, where they looked at literally every single anaesthetic complication between, I think it was for an entire year, in all the hospitals in the UK. So, do you see what I mean by major audit? And actually, they found that the majority of complications happened either in ICU or in the emergency department. The least amount were in actual surgery. But when they were actually looking at the anaesthetic complications in fat people, then there's an entire chapter dedicated to the O word. When they were looking at these complications, they found that it was doctor error. Oh, not enough. No, the equipment wasn't right. There wasn't senior people on staff. They didn't have a plan B. They used the wrong, intubation technique. What was another one? It was one that I was like, oh, blimey. Didn't plan for didn't give enough anaesthesia, so people woke up during surgery. All of this stuff, and so it was basically down to technique and seniority or experience and the right facilities. None of those have anything to do with the patient or the patient's body size, and have everything to do with the people in charge. So of course it's really easy to shift the responsibility. Oh, anaesthetic complications because you're fat, as opposed to anaesthetic complications because we're not good enough at anaesthetising fat people. Again, it's not an excuse, is it? It's really not an excuse. I'm sick and tired of people using this as an excuse. We're incompetent and therefore we won't do your surgery. No. It's your job to have the right masks. And one of the findings in the chapter, it's really interesting when you actually read this audit, which I did. I read the whole thing. And if you read the audit, I didn't understand most of it because, again, I didn't do much anaesthetics when I was doing my junior doctor training. But if you read the audit, they make it very clear the recommendations. Some of them are very practical, like try this technique or make sure you do this, make sure this. But if you read in between the lines, and actually sometimes explicitly, it was like, make sure that you have the right equipment. And patient safety, this was one of my favourites, patient safety is more important than anything else. Because let's face it, a lot of hospitals will choose cost over safety, right? We'll buy the cheapest things rather than the best things. Surgeons, anaesthetists need more time with their fat patients. Well, that means that we're going to have to pay our professionals to spend more time with. Again, it's going to take me longer to do the same job. You can understand why they don't want to do it. They just don't want to do it because it's going to take me longer and I'm getting paid the same and I don't want to do that. Again, if that's the way you feel, don't do the job. Find another job. You signed on the dotted line when you became a doctor that you were not going to discriminate against patients, full stop. You don't get to pick and choose who you want to treat. Right. Are there any more? I'm trying to think if there were any more that I could come up with that would make you laugh. No, I think I've run out. But there are so many more. Doctors just really take the piss. Maybe you've been told that you can't have surgery for one of these reasons. Maybe your doctor's lied to you, made up some nonsense about how your tummy will get in the way, or you're going to experience pain. Yeah, and you might get an infection. All right, that's fine. What I want to explain is that I mentioned it earlier on, I think, there's this pesky little thing, pesky for surgeons, called autonomy. My right to choose what happens to my body. It's enshrined in medical law, in medical ethics. Autonomy. In order to have autonomy, I say this over and over again, you must have agency. Agency means I get to decide, that I actually have the ability. It's not just the theory that it's my body, it's my choice. Is that practically I get to make a choice about my body. When you tell me that I can't have surgery unless I lose weight, you take away my autonomy. You're not giving me a choice. Where's my agency? You're forcing me to do something I don't want to do. And I have every right to refuse weight loss. I can just say, no, I don't want to do it. I don't have to explain why I don't want to do it. I don't want to do it. I don't want to lose weight. Well, then you can't have your operation. You've just taken my autonomy away from me. And for no good fucking reason. You know, I made the point in the masterclass, if it was cosmetic, the procedure, I would still argue the rules of autonomy are the same. But if you said, well, the only benefit to you would be cosmetic, but the risks are blah, 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 I still believe that patients have the right to choose. But as a surgeon, you might say, I'm not prepared to put you at all of that risk for a purely cosmetic procedure. And that would be, I would argue, possibly is it your right to decide? I'm not sure. That's a tricky question. Maybe we need to have a debate about that. But it's not a cosmetic procedure. People who have arthritis of the hip will eventually end up being wheelchair bound. So say the studies. Within about an average, I believe, of 5 years, will be wheelchair bound. The pain is unbearable and the disability is life-changing, life-altering. Not being able to use one of your hips, being in pain when you attempt to use your hip or knee is unimaginable unless you are going through it. And really, there is, when it's mild, physical therapy. And any decent physical therapist will tell you that if the exercises, the resistance exercises I'm teaching you to do, and they're great. I don't have a problem with exercise or movement. I shouldn't say exercise, but resistance training or physical therapy, specific exercise that improve and build up the muscles surrounding the joint. I'm with you. That does stabilize the joint. It does help with pain. Exercise also increases your bone density, which helps with arthritis. So I'm all for movement. But when the movement becomes painful, any decent physical therapist will tell you to stop. Don't do the exercise if it hurts. So if you get to a stage where there isn't an exercise you can do without it hurting, physical therapy no longer is an option for you. Then there are steroid injections. And sometimes they work. But I don't know the statistics, like the success rates. You'd have to ask an expert. But for a lot of people, they don't. I've tried that. I've had one. I've had two. Didn't work. All right. Well, then there's no point in having any more. Physical therapy is out. Steroid injections out. What's left? Surgery. Does surgery work? Fuck yes. Does it work better for people who are thin compared to people who are fat? No. The studies have made that very clear. No matter what weight you are, irrespective of weight, you will improve. Your condition will improve. There's a study to show this. Can you reduce your risk of complications, short-term complications, by losing weight? No. There's a study to show that. What about long-term outcomes? If you lose weight prior to surgery, will your long-term outcomes be better? No. Again, there's a study to show that. Studies, I should say, to show that. It doesn't make a difference. So in forcing somebody to lose weight prior to surgery accomplishes two things. Number one, because most people can't achieve it or don't want to achieve it, that's a way of quite literally trimming the fat. I'm trimming the fat by getting rid of fat people because I'm just going to say you have to lose 10% of your body weight. Most people won't achieve that, so that's that done. But also, it supposedly will make things easier for the surgeon. And I'm not in the business of making things better for surgeons. I could give a fuck about surgeons, if I'm honest. I mean, I didn't even like them when I was working as a physician, but now, fuck them all, as far as I'm concerned. Yes, I said that out loud. If you're part of the GMC, you heard me correctly. Fuck you and fuck them. I'm in no mood to pander to miserable, snivelling fools. The GMC, I hope you all know this, are investigating me for anti-Semitism at the moment because a Jewish grandchild of a Holocaust survivor who stands up for the rights of Palestinians is anti-Semitic and deserves to be investigated by the General Medical Council. I'm in good company. So many Jewish people who are standing up for Palestinian rights and are being arrested and all sorts of things. So I'm in good company. And not to mention my Muslim brothers and sisters, or my Muslim siblings, I should say, who are standing up and being accused of anti-Semitism the moment they stand up for Palestinians. Yeah, not to mention them. They've got it harder because at least it's harder to prove that I'm anti-Semitic being a Jew. Either way, fuck the GMC and fuck surgeons who think they can get away with this bullshit. I just had to get it off my chest. Thanks for listening. All right, so did you find that useful? I don't know. I'm just rambling today. It's late. Once again, I'm totally disorganized, and I need to get this podcast out ASAP. So this is my offering for this week. I promise I'll get back to my example patients soon, because people really like those and I haven't done them for a while. But I think this is episode 38, 39, something like that. I'm going to take a break after episode 39, folks. I'm going to take 2 weeks off. I've decided every 10 episodes I'm going to give myself a couple of weeks off, just to just recover a bit. So I think you might hear from me for one more week, and then I'll take a break, and then I'll see you soon after that. Plenty more offerings. If you happen to be listening on the day that this is released, I have my free workshop at 2:00 on Wednesday, the 6th of November. I said free because it's free. We're going to be talking about why weight loss is unsustainable, and the actual science behind it. We'll be quoting studies. There will be PDFs, and there will be links to studies for those of you who want me to show my work. I kind of I hate it when people say that to me. Prove it. It's like when I was at school and I did the maths, and then I'd get the answer right, but then the teacher would mark me down for not showing my work. That's how it feels. Like, I'm not just going to say it if it's not true. Like, why would I do that? But okay, I will show my work in this workshop, and it's free. Did I mention free? Go to learn.fatdoctor.co.uk, go to No Way, and you can register. And don't worry if it's been and gone. Like, you can still watch the replay for free whenever you want to. So even if you're listening to this 2 years from now, you can still watch it. I can't wait. It's going to be so exciting. All right, I'm going to go. Thanks very much for listening. See you next week. I think, possibly, maybe, probably. Bye-bye.